Hi everyone. This is not going to be a very long video. I would like to briefly raise one issue. The title of the video is, as you can see, Take Care of Your Penis. You know why? The penis is a unique organ, not a double organ like the kidneys or the lungs. So there is no substitute. More importantly, the penis is like no other organ. We plastic surgeons know very well how to back up different tissues, because that's the main part of our job. Let's say there is a bone defect somewhere, you take a piece of bone from another part, put it there and repair it. Or let's say some of the skin is missing due to a large wound. We take a spare piece of skin from another part of the body and patch it on the wound. So we often use spare tissues for repair. But this is not the case when it comes to the penis. This organ is both unique and has no substitute. So I advise you to take good care of it. What changes does aging cause in the penis? There are two main changes. First, visual changes. Second, we have functional changes. Here our main topic is visual change. Let me explain this in detail. So let me say, penile structure in humans is generally of two types. That's what people say too. They call it blood penis or meat penis. The penile structure called the blood penis is defined in medicine as a retracted penis. In the non-erect state, they tend to look pitiful. It shrinks. It collapses. The penis may shrink to a centimeter in length. So this structure is popularly known as blood penis. In non-erect state, the penis hardly impresses, but when in erection, it may reach, 18 centimeters. So this does not affect the erection. However, it shrinks a lot when not filled with blood. Let me drop in a footnote. This situation causes problems for us during fat injection. Why? Let's say you are performing augmentation by injection, but following the surgery, you may very well end up with a shrunk penis and the fat layer injected is folded telescopically on top of itself, together with the skin, and a deformity appears. Such a problem is usually corrected with a second fat injection. A second fat injection is generally necessary. This is known as the blood penis, the penis that shrinks a lot when not filled with blood. The second type of penile structure is popularly called the meat penis. What does that mean? The penis is constantly protruding, drooping 8 or 10 centimeters. It never shrinks so much. Patients say that it only shrivels in the cold, which is a quite normal reaction. But they don't say that their penis shrinks to 1 centimeter when not filled with blood. Penile tissue is always protruding. It does not have a specific name in medicine. This is the normal, desirable situation. And with aging, the following changes appear. The erectile spongy tissue of the penis wears out and ages. Its structure breaks down and begins to collapse. A normal penis, popularly known as a meat penis, so a straight and protruding penile tissue under normal conditions, begins to shrink and shrivel. After a certain age, the patient sometimes wakes up in the morning and sees that his penis has got smaller. His penis, which was normally protruding, has now shrunk to 1 centimeter. And the patient is often terrified. 1 or 2 years ago, a fellow physician called me saying, "Oytun, I don't understand what's happened. I just woke up in the morning, my penis has shrunk. How can this happen?" He was really horrified. Well, normally this doesn't happen overnight. With aging, the spongy tissue of the penis gradually deforms and turns into a retracted penis. The penis begins to shrink, but the patient realizes this when he wakes up one morning. The penis has shriveled, retracted, and become what is popularly called blood penis. Patients are of course horrified when they encounter this scene. This is actually nothing too serious, but as I said before, it poses a problem in penile enhancement. Injected fat does not stay as it should in these patients. When the penis descends and shrivels, the skin folds over and the fat is accumulated in these layers. What happens then? The penis may experience a convex deformity. It will not stand straight. When fat is injected for augmentation to protruding penises, popularly described as a meat penis, you will get a very smooth appearance after fat injection. The diffusion of the fat tissue does not deteriorate, but when the penis shrinks and the skin folds over, the fat injected also gets folded, causing a deformity. So it is aging that causes deformity. And when the patient undergoes penile augmentation, the fat injected into a retracted penis will not diffuse nicely and will accumulate. So this is one important issue. And secondly, we also encounter erectile dysfunction with aging. Well, since this is a functional problem, this does not really fall within our scope. It's outside my field. We surgeons do not work on erectile dysfunction. This is a subject for urologists. But to put it briefly, what are the factors that disrupt erectile function of the penis? You should avoid them. Smoking is the main culprit. Smoking affects blood vessels and thereby the erectile function is impaired. Hypertension, likewise. If you are suffering from high blood pressure, my advice to you is to start medication as soon as possible. Then diabetes. Diabetes destroys both nerves and blood vessels. As it destroys the veins at the extremities, ultimately, the erectile function is also affected. Diabetes, smoking, hypertension are the three main factors that impair erectile function. You need to deal with them and immediately start treatment if possible. In addition, I can mention overweight and stress. Excess weight and stress are also factors that impede erection. You need to take precautions for them as well. And also, traction devices or vacuum pumps supposed to enlarge your penis. I think that these instruments do not help. On the contrary, they damage the penis. I think that traction devices definitely damage the penis. I think it disrupts the structure of the erectile tissue if used for a very long time, and if you force the erectile tissue when stretching. This is my opinion. There is also something called traumatic masturbation. Some people prefer to masturbate by squeezing the penis between two objects, like two pillows or two cushions. Some people like that. And this is another issue that damages the erectile tissue. In short, don't squeeze, don't stretch, don't crush or vacuum the penile tissue. Such interventions damage the structure of the erectile tissue later on in life and over the years cause erectile dysfunction. In fact, traction and vacuum pumps, in particular vacuum pumps, darken penis skin after many years of heavy use. So these not only cause hardening of the erectile tissue, but also makes the penile skin much darker. The penile skin gets a darker color. That's why I don't recommend these instruments. You won't need them after penile enlargement surgery. I advise patients who want to use it to try them, yes, alright, but not for many years. You may try it, but I don't recommend using them for a long while. As I've said before, squeezing, crushing, stretching the penile tissue damage the structure of the erectile tissue. Smoking, hypertension, diabetes, stress should be avoided and, of course, treated. I won't take too much of your time, but I don't see many articles or informative videos on this topic on the internet. As tissues begin to deteriorate with aging, a normal protruding penis begins to get smaller, shrink, and shrivel. It turns into a retracted penis. For someone accustomed to seeing his penis protruding and drooping, this is a terrifying scene. The patient wakes up in the morning and half the penis is gone. It has become smaller, shriveled. And the patient is terrified. But for example, patients with a retracted penis have such a penile structure at a young age. The man's penis does not change, it is already retracted. so he is used to seeing that scene. They do not experience such a trauma. This man for sure does not experience horror, but patients with a normal, protruding penile structure are horrified when they see their penis get smaller after a certain age. Just know that this is not something that happens overnight. Someone didn't cut half of your penis off. It is something that normally happens gradually, but the patient realizes it suddenly. So it is basically all about aging. As I've said, this is not a very long video. After all, I don't have that much to say. What I would like to recommend to you, once again, is not to squeeze, crush or stretch your penis. Simply take care of your penis. It is unique and has no substitute. If there were a similar tissue somewhere, we plastic surgeons would of course repair or reconstruct it, but unfortunately, it is a single and unique organ in the body. So thank you for tuning in. See you on the next video.